Hello, in this video, I'm going to talk about knee injuries, rehab, and considerations. So there are many knee injuries, but here I'm going to highlight the ones that you are most likely to encounter working with athletes or in an orthopedic environment. Medial collateral ligament sprains. So the medial collateral ligaments are the primary restraints located on the medial side of the knee. Sprains to these ligaments are usually caused by a valgus stress. So that could be like an impact to the lateral side of the knee, or it could be non-contact valgus. Hyperpronation in the feet, so like maybe you step funny or you step on like a hole in the ground or something like that, and it allows hyperpronation that causes the knee to go into an excessive amount of valgus that could injure that medial collateral ligament. Lateral collateral ligaments, exactly the opposite. So the restraints on the lateral side of the knee. So they'd be injured by varus stress, so like an impact to the medial side of the knee or internal rotation of the tibia on the femur. All right, so ACL ligament sprains, most often caused by non-contact torsional stress, also can be caused by force causing anterior displacement of the tibia relative to the femur. So like an impact on the tibia from the posterior side that pushes the tibia forward would injure the ACL. But more commonly, we have a torsion stress where the tibia is going in one direction and the femur is going in the opposite direction. So it's that twisting force that is the most common cause of an ACL sprain. So that's like cleat is stuck in the mud and you turn and cut to go the other direction. So the femur is turning and cutting to go in the direction you want to go, but the tibia is stuck facing the opposite direction because the cleat is in the mud and it didn't turn. So that's the most common scenario, is something like that. Posterior cruciate ligament sprains, typically caused by either knee hyperextension or a blow to the anterior tibia. So, like someone gets kicked hard enough in the shin, can cause a posterior displacement of the tibia relative to the femur, and that would injure the posterior cruciate ligament. Or a hyperextension mechanism would also injure the posterior capsule and the posterior cruciate ligament. Okay, meniscus tears can be caused by rotation and flexion of the knee that pinches the menisci between the articular condyles. Okay, so of course, flexion extension is a normal movement of the knee, but when we add to that rotation, especially if it's an excessive amount of rotation while we are going through that flexion extension range of motion, it causes the meniscus um, to endure stresses abnormally, essentially. So if there's too much, I'm trying to think of how to do this. Like if there's too much rotation happening as we go through the flexion extension, it'll sort of grind at the meniscus at an angle that the meniscus is not built or designed to tolerate. And so then that can cause it to tear. And depending on the nature and the amount of those forces, the direction of those forces, it'll cause all different types of tears, like we see in the picture here. A torn meniscus will classically cause a locking, clicking sensation, just like we talked about with a torn labrum. So same thing, when we tear the cartilage, it'll give sort of a clicking, locking sensation while you move through normal range of motion. Can also cause pain along the joint line, which would, the joint line in the knee would just be a straight line across the knee right underneath the patella. So it would cause pain there. And again, not because the meniscus hurts, but because damage to the meniscus would impair the function and the health of the other structures inside of the joint capsule and the joint capsule itself. Also could give the feeling of the knee giving way, which again is the way the person would express instability of the knee. So instability is a subjective symptom that the person would report, and they would say, it feels like my knee gives out when I try to put weight on it. So that could be a sign of a meniscal tear. So there's lots of different types of meniscal tears, and they're named according to how and where the meniscus is torn. Okay, iliotibial band friction syndrome is exactly what it sounds like. It's where we have the iliotibial band creating friction over the lateral condyle of the femur. Okay, so there is the iliotibial band going all the way down the lateral side of the thigh. Then it crosses over the lateral condyle of the femur, crosses the knee, and inserts down into the lateral leg, just distal to the knee joint. So when we have pain there, we would call that iliotibial band friction syndrome. So it's friction between the IT band, which is often pulled pretty taut there over the lateral condyle. So it's friction between the band and the lateral femoral epicondyle. So anything that causes more tension on the iliotibial band, so it becomes sort of tenser and tighter, that will cause more friction every time we flex and extend the knee. So the more taut it is, the rougher it will be as it rubs back and forth over the lateral condyle. So a looser, softer IT band will cause less tension and friction there and is less likely to cause this condition. So anything that causes it to be more tense can lead to this. So repetitive knee flexion extension, like running, rowing, and cycling, especially with overstriding, so like running downhill, is going to be more likely to cause iliotibial band friction syndrome than would running uphill or running on a flat ground. So that's because it can increase the tension between the IT band and the lateral epicondyle. May also cause bursitis and periostitis of the epicondyle. Okay, so it could inflame a bursa located there in that area, and it could inflame the periosteum of the bone, the periosteum that's covering the lateral condyle there. Okay, tibiofemoral dislocation. This is very serious. So hyperextension or any extreme force across the knee joint line. So an extreme force in any direction really could dislocate the tibiofemoral joint. And this is a medical emergency. So aside from it being really scary and painful, this could result in loss of limb. So depending on what exactly is damaged and in what way and to what severity, there could be loss of blood flow to the whole segment distal to the knee, because we could have had rupture of very major arteries that are traveling down past the knee. And so this is considered a major medical emergency. Of course, really any of these injuries I'm talking about are serious, but like an ACL injury or other types of injuries, they're painful and they need to be addressed. But they can kind of, the care for those injuries might be sort of dragged out a little bit as they're assessed and evaluated by different professionals, and you're recommended for surgery or not, and you schedule it and that sort of thing. Something like this is an immediate medical emergency that requires, going straight to the emergency room and immediately addressing it, because loss of blood flow to that distal part of the extremity could mean loss of that extremity if it's not restored immediately. So it's a severe injury that includes rupture of 3 or 4 out of our 4 of the primary knee ligaments, plus injury to the joint capsule, musculotendinous structures, the menisci, articular surfaces, blood vessels, and nerves, which is why this is so serious. So a lot of these structures are not necessarily what makes it an emergency. It's painful, it's damaging, it's a problem. But really it's the loss of function of the blood vessels and the nerves that are what make this so serious and emergent. Okay, patellofemoral pathology can be caused by overuse, congenital malalignment, insufficient motor control, or trauma. Okay, so there are lots of different things that can lead to problems with the tracking and normal function of the patellofemoral joint. Patellofemoral pain syndrome is a diagnosis of exclusion in cases of anterior knee pain. So what we mean by that, whenever we call something a diagnosis of exclusion, what we're saying is that once we've ruled out everything else this could possibly be, we would call it this. So if we've excluded any other possible diagnosis of whatever the symptoms, based on the signs and symptoms of what is happening in the knee, if we rule out everything else it could possibly be, then this is kind of a collect all diagnosis that includes whatever wasn't diagnosed as something else. Okay, so in the case of anterior knee pain that is not diagnosed as something else, we would call it patellofemoral pain syndrome. So it can depend on a lot of different factors. So the geometry of the femur. So like specifically, if we look at the angle of the femur at the hip as it approaches the knee, so the Q angle is what we call that. So we look at the geometry of the femur, like how is it shaped? What are the angles of the femur? Excessive knee valgus, so that inward or that medial angulation of the knee, which could be caused by a variety of different things. Lateral tracking of the patella. So if the patella is kind of on the lateral part of the knee rather than being more located more centrally where it should be. So that could be caused by insufficient hip adductor control or excessive pronation. So we know that because of regional interdependence, whatever our feet and ankles are doing is going to affect our knees and our hips and our back. And so this is an example of where if we're excessively pronating, it will cause the patellofemoral joint to track incorrectly, which could be painful. Okay, patellofemoral instability can be caused by dislocation or partial dislocation. So the patella can completely jump out of its track, or it can partially be not quite in the right place. And that's really what we mean by partial dislocation. So it typically occurs in the lateral direction because usually it's the medial static restraints are not strong enough to hold it in the correct place. So it most commonly happens laterally, um, but it can happen in the medial direction too. When this happens, it can cause deformity and spasm of quadriceps muscles, and subtle subluxation can make the knee give out when weight bearing. Okay, so when the case sort of totally jumps out of its track, the quadriceps are going to spasm intensely and try desperately to pull the patella and its tendon back into place. And so there would be a severe spasm and a visual deformity of the knee that would take place in that total dislocation of the patella. A subtle subluxation, meaning like a partial dislocation or it's just slightly not in place, and the person then tries to take a step, they will have the sensation of the knee giving out, which again is instability. So it's that subjective sensation that the knee gives out when you try to put weight on it, or that the knee isn't able to hold their weight. So tendinopathies in the patellofemoral joint can occur in response to trauma or sudden increase in activity. So the word tendinopathy is just a collective term to mean pathologies of a tendon. So that can include like tendonitis, tendinosis, or like a rupture. They have multifactorial causes and are common in jumping, running, and weightlifting activities, especially with repetitive knee extension when the patella is misaligned. Okay, so most often this would happen where the patella is not exactly in the right place. So it might be slightly subluxated, or it might track a little bit incorrectly because of certain abnormal muscle relationships or muscle tendon tensions. So if it's not tracking correctly, and then you're repetitively going through knee flexion extension, especially under force, like during weightlifting or running or something like that, then those forces will over time break down the tendon and also could cause inflammation in the tendon. Okay, Osgood-Schlatter disease is very much most common in children and adolescents, to the point where you can often determine if it's Osgood-Schlatter depending on their age group and the location of the pain. Okay, so during growth, the bones sometimes grow faster than the muscles, placing excessive tension on the muscles and their attachments. So if you think about growing pains, what does that actually mean? And usually what we're talking about is a condition like Osgood-Schlatter, or pains leading up to this, or maybe it's not necessarily a full diagnosable case of Osgood-Schlatter, but it might be somewhere kind of on the way. But what happens is when we're growing, like during childhood and adolescence, the bones are sometimes growing longer, faster than the muscle can grow in length to keep up with it. So the muscle is becoming stretched, it's becoming more and more taut and pulled tight as the bone is growing faster than the muscle can grow in length. So as that's happening, more and more tension is being put on the muscle, which is transferring, to more and more tension on the tendon at its attachment to the bone. So when that happens in the case of a quadriceps tendon, the quadriceps muscle, and its attachment at the tibial tuberosity in the anterior part of the proximal tibia, like we see in the picture there, it's pulling and putting excessive amounts of force through that tibial tuberosity right there on the front. So excessive tension stress is placed on the tibial tuberosity, causing osteochondritis and repeated avulsion fractures in very advanced cases. So it might just be a matter of inflaming the bone and cartilage located there, but it can be much more severe than that and actually be causing little chips of the bone in that area to actually fracture. So it's very painful condition. And right away that this is what it is when it is a child or adolescent, and that's the location of the pain. So if it's an adult with pain there, you might be looking to another type of condition or another type of injury mechanism. Or if it's a child or adolescent, but the pain is located somewhere different, then it'd be something else. But pain located there in a child or adolescent is Osgood-Schlatter disease. So it can also be caused by the quadriceps muscles rapidly increasing in strength faster than the bone can become stronger to withstand the stress. So there's an example of how this could occur in an adult, but this would be less common. This would be like somebody who might be abusing steroids, as an example, where the steroids are causing their muscles to grow and become stronger faster than the bone can grow and become more dense and strong to withstand the stress. And so then in that case, the bone at the tibial tuberosity is being broken down by the much stronger muscle. Like we talked about in the case of like a bicep tendon rupture, or this can also happen in other injuries. So it's much, much less common in terms of it happening in adults, and for that reason. So it's mostly going to happen in children and adolescents. Causes symptoms similar to patellar tendinopathy. So it's the same kind of localized pain, but the difference is, does it hurt on the tendon itself or at the tibial tuberosity where the tendon inserts? So it can be identified based on the person's age and the localization of pain over the tibial tuberosity. Okay, patellar tendon rupture happens due to sudden overloading during knee extension. Okay, so when we're exerting too much force during knee extension, it can cause the patellar tendon to rupture. Can also cause an avulsion from the inferior patella or from the tibial tuberosity, depending on which tissue and which part of the tissue had the greatest weakness. That would be what fails during that excessive amount of force. And as you may recall, because these are viscoelastic materials, it will also depend on the rate of loading. So when we have a faster rate of loading, the bone gets stronger and the tendon gets weaker under that stress. So with a fast, so like we're saying here, due to sudden overloading, so a fast loading mechanism is going to be more likely to rupture the tendon than it will be to cause an avulsion or a fracture to the bone. A slower movement or slower loading mechanism would be more likely to cause an avulsion or a fracture to the bone. Now, this is very uncommon in healthy individuals. So healthy, normal individuals with no other underlying conditions, this is extremely uncommon for it to happen in that population. It can happen, but it's way less common. More often, it'll happen in somebody with some other underlying condition like rheumatoid arthritis, diabetes, lupus, someone who has had corticosteroid medications, whether oral or injections into the joint. or other predisposing conditions. So it tends to be someone who has some other kind of chronic condition or exposure to steroid medications that could cause weakness in the tissues. So that person would be more likely to suffer this type of injury. Okay, thanks so much for watching, and I'll see you for the next video.